Hey future nurses, welcome to another NCLEX review session. Today we're diving into the top 15 NCLEX medical surgical nursing questions that every RN and LPN candidate must know. If you're preparing for the NCLEX exam or just brushing up on your nursing knowledge, this practice test will help you feel confident, prepared, and exam ready. Let's see how many you can get right. Question. The nurse is caring for a client with chronic obstructive pulmonary disease, also known as COPD, who is receiving oxygen therapy. Which of the following oxygen delivery methods should the nurse use to provide the most accurate concentration of oxygen? Option A, simple face mask. Option B, Venturi mask. Option C, nasal cannula. Option D, partial rebreather mask. Correct answer, B. Venturi mask. Rationale. The Venturi mask provides a precise and controlled oxygen concentration, ideal for clients with COPD. Question 2. The nurse is preparing to administer packed red blood cells to a client. Which of the following actions should the nurse take first? Option A. Verify the client's identity using 2 identifiers. Option B. Obtain vital signs. Option C. Check the blood product with another registered nurse. Option D. Prime the IV tubing with normal saline. Correct answer. C. Check the blood product with another registered nurse. Rationale. Verification with another nurse is a critical safety step before beginning the transfusion. Question. 3A client with heart failure is prescribed furosemide. Which of the following findings should the nurse monitor for as an adverse effect? Option A, bradycardia. Option B, hypokalemia. Option C, hypokalemia. Option D, hypertension. Correct answer, C, hypokalemia. Rationale. Furosemide causes potassium loss, which can lead to hypokalemia. Question 4. The nurse is teaching a client who has a new colostomy about stoma care. Which of the following statements indicates that the teaching was effective? Option A. I should use alcohol wipes to clean the stoma. Option B. I'll change the pouch every 7 to 10 days. Option C. I'll clean the stoma with mild soap and water. Option D. I'll cut the wafer opening smaller than my stoma. Correct answer, C. I'll clean the stoma with mild soap and water. Rationale. Gentle cleaning helps prevent irritation and infection. Question. 5. The nurse is caring for a postoperative client who suddenly reports chest pain and difficulty breathing. Which action should the nurse take first? Option A. Notify the healthcare provider. Option B. Check the client's blood pressure. Option C. Raise the head of the bed and apply oxygen. Option D. Administer prescribed analgesics. Correct answer, C. Raise the head of the bed and apply oxygen. Rationale. This action helps improve oxygenation immediately. Question 6. The nurse is teaching a client with type 1 diabetes about foot care. Which statement by the client shows correct understanding? Option A. I'll soak my feet daily in warm water. Option B. I'll check my feet every day for cuts or blisters. Option C. I can walk barefoot indoors. Option D. I'll trim my toenails close to the skin. Correct answer, B. I'll check my feet every day for cuts or blisters. Rationale. Daily inspection prevents unnoticed injuries that could lead to infection. Question 7. The nurse is assessing a client with left-sided heart failure. Which findings should the nurse expect? Option A. Jugular vein distension. Option B. Peripheral edema. Option C. Crackles in the lungs. Option D. Hepatomegaly. Correct answer, C. Crackles in the lungs. Rationale. Left-sided heart failure causes pulmonary congestion. Wait, before we continue, if you're finding these NCLEX Med-Surg questions helpful, hit that like button and subscribe for more nursing exam prep, NCLEX review videos, and practice tests for RNs and LPNs. Drop your score in the comments below. Let's see how you're doing on this NCLEX practice test. Question 8. The client with peptic ulcer disease is prescribed omeprazole. The nurse understands that this medication works by which mechanism? Option A, neutralizing stomach acid. Option B, inhibiting gastric acid secretion. Option C, coating the stomach lining. Option D, increasing gastric motility. Correct answer. B, inhibiting gastric acid secretion. Rationale. Omeprazole is a proton pump inhibitor that suppresses acid production. Question. The nurse is teaching a client with hypertension about following a low-sodium diet. Which food choice indicates correct understanding? Option A, canned soup. Option B, smoked sausage. Option C, fresh fruits and vegetables. Option D, pickles. Correct answer. C, fresh fruits and vegetables. Rationale. These foods are naturally low in sodium and promote heart health. Question 10. The client with cirrhosis is at risk for hepatic encephalopathy. Which of the following findings should the nurse monitor for? Option A, polyuria. Option B, confusion and asterixis. Option C, decreased ammonia levels. Option D, bradycardia. Correct answer. B, confusion and asterixis. Rationale. Elevated ammonia levels affect the brain, leading to these symptoms. Question. The nurse is providing discharge teaching to a client after cataract surgery. Which instruction should the nurse include? Option A, avoid bending at the waist. Option B, rub the operated eye if it itches. Option C, use both eyes to read immediately. Option D, shower with water directly hitting the face. Correct answer. A, avoid bending at the waist. Rationale. Bending increases intraocular pressure and may cause complications. Question 12. The nurse is caring for a client with a chest tube. Which finding indicates that the chest tube drainage system is functioning properly? Option A, constant bubbling in the water seal chamber. Option B, fluctuation of fluid with respirations. Option C, no drainage in the collection chamber. Option D, the tubing is clamped. Correct answer. B, fluctuation of fluid with respirations. Rationale. This shows normal pressure changes and tube patency. Question 13. The client receiving chemotherapy reports mouth sores. Which nursing action is most appropriate? Option A, use alcohol-based mouthwash. Option B, offer soft, bland foods. Option C, brush teeth with a hard bristled brush. Option D, encourage citrus juices. Correct answer. B, offer soft, bland foods. Rationale. Soft, bland foods minimize irritation of oral tissues. Question 14. The nurse is caring for a client following a thyroidectomy. Which finding requires immediate intervention? Option A, sore throat. Option B, hoarseness. Option C, difficulty breathing. Option D, nausea. Correct answer C, difficulty breathing. Rationale. This indicates possible airway obstruction and is a medical emergency. Question 15. The nurse is assessing a client with suspected appendicitis. Which finding should the nurse expect? Option A, left lower quadrant pain. Option B, right lower quadrant pain with rebound tenderness. Option C, painless abdominal distension. Option D, hypoactive bowel sounds. Correct answer. B, right lower quadrant pain with rebound tenderness. Rationale. These are classic signs of appendicitis due to inflammation of the appendix. Awesome job, future nurse. You've just completed practice test 1 of our top 15 NCLEX medical surgical questions. Don't stop now. Check out the next NCLEX review video for practice test 2 and keep improving your nursing knowledge. If you enjoyed this nursing practice test, make sure to like, subscribe, and turn on the notification bell so you never miss an NCLEX update. You're one step closer to becoming a licensed RN or LPN. Keep going, you've got this.